Good morning, everybody, and welcome to number 5 of 6 of the Driving Health webinar series, giving you some snippets, some information, and some of the results in bite-sized chunks, because this is a 3-year study and we're 2 and a bit years through, and so we didn't want to overwhelm you, so we've pulled them out into little bite-sized chunks. So this is number 5, Driving Through Pain. And it's exciting to be here today to be able to give you some more of these results. And if you're wanting the full information, it's on our website, drivinghealth.net, as well as the opportunity to be part of the intervention program going forward, which is launching in October. So as I said, we've got extensive information over the last 2 and a bit years of research in this area through our Driving Health team at Monash University. And I'm Dr. Elizabeth Pritchard, one of the team, and I'm going to introduce you to Associate Professor Ross Iles in a minute. So just to let you know, we will have time for questions at the end of here. So make sure you find the Q&A link below in the Zoom or the chat box. And so pop your questions in there throughout the time so that you don't lose your questions. And we will have time at the end to address your questions going forward. So it is exciting to be part of this study because it's a revolutionary study that is for driving health truck drivers across this whole of Australia. And so I'm going to hand over to Associate Professor Ross Iles, who's the Deputy Director of the Insurance, Work and Health Group, and also the leader or the primary investigator in the study. So thank you, Ross, for today, Driving Through Pain.
Thanks very much, Elizabeth. I'm well prepared today. My phone is on silent. My children hopefully won't interrupt this one, and my dog is in the background, so it may bark, which is exactly what happened at the last. It's what happened last week. So I'm sure everyone knows what that's like at the moment. But I'll share my screen. Hopefully, Elizabeth, you'll let me know that that's all working okay. Great. So thanks very much for joining us today. As Elizabeth said, this is number 5 of our webinar series. We're trying to break the findings up into small bite-sized chunks. Everything is available on the website, drivinghealth.net. We've tried to put things up there in their fullness. So there are big, long reports there, but there are also summaries that are designed to be a little bit easier to read so you can pull out the facts that you need. But everything that I'll be talking about today is available on the website in those different reports. We've just tried to put it together in a way that hopefully makes it a little bit easy to find that information. And as Elizabeth said, it's quite a team working on the Driving Health project. So I'm lucky enough to be talking today, but there's a cast of thousands in the background that's been working on these findings. Now, if this is your first webinar, we'll give you some background on what the Driving Health project is about. So it is a 3-year research partnership with our research partners Linfox, the New South Wales Centre for Work Health and Safety, and the Transport Workers Union, and we've been supported by the National Health and Medical Research Council Partnership Project Scheme. And to our knowledge, it's the largest Australian-based study really focused on the health and wellbeing of truck drivers. So there's a large body of research that comes from North America and Europe, but we believe it's critical to have evidence that represents Australian drivers working under Australian conditions. Now, the Driving Health study has examined multiple sources of data to come up with our findings. Some of this comes from existing sources. So for example, more than 120,000 accepted claims for workers' compensation from truck drivers. Some of it involves using data sources for the first time. So for example, one of our reports focuses on the data we can draw from 3,500 death benefit claims from the largest industry superannuation fund for workers in transport. On top of that, we have also generated new data from over 1,400 drivers in the form of an online survey. We've then conducted some follow-up telephone surveys so we can ask a few more questions, and then gone on to have in-depth interviews with drivers and their family members to really get to really sort of understand some of the things that we're seeing in some of the other parts of the data. And we think the result is the clearest picture to date of the health and wellbeing of Australian truck drivers. Gone the wrong way. So today's webinar is really going to be focusing on pain, and so the information that we found from our research about pain. Now, our online survey was completed by, as I said before, nearly 1,400 drivers, and we asked them about their current experience of pain. And what's really great is that over a third, you can see on the green bar at the bottom of the graph there, reported no pain, which is great. But what this means is that more than 860 drivers in total said that they currently were dealing with pain. And so if they did have pain, we asked them to rate their pain on a scale from 0 to 10, where 0 is no pain and 10 is the worst pain you can imagine. This is a common way that health professionals would use to get an indication of the severity of someone's pain. And the results were a little bit startling. So that means that what we can see on this graph, 2 in every 5 drivers described their pain as greater than a 4 out of 10. So our category for mild pain was somewhere between 4 and 6 out of 10. And that severe rating is 7 or higher out of 10. And in our sample, it was just under 11% actually reported severe levels of pain. And that's actually a higher proportion than reported for the general Australian population, which in population-based surveys sits at a little bit over 7%. So our drivers are actually dealing with quite a lot of pain. And I'll give you some quotes from our interviews. So in drivers' own words. So one driver said, "Yes, it is because anytime I grab the steering wheel, it's that bad that I can't turn the wheel with it. So it's really, really painful." And this from another driver. But the other week, I was teaching a guy to drive a truck sitting in the passenger seat for about 4 hours and I could hardly walk the next day. That driver went on to say that was a result of the passenger seat not being quite as good as the driver's seat. But it gives you an idea of, I guess, the severity of the pain that drivers are actually putting up with and the impact that will have on their day. So these quotes are sort of really about the short-term bouts of pain and the impact. When drivers said they had pain, it was usually chronic, and that is, it lasted more than 3 months. So that's the 2 blue portions on this graph. So 15% said it had lasted somewhere between 3 to 12 months, and 56% said greater than 12 months. So you add that up, and 70% of drivers in our survey are actually dealing with chronic pain. And we compared the responses across these 2 pain questions between long and short haul drivers. And there were no significant differences in pain severity between long and short haul drivers, but more long haul drivers reported pain that had lasted for longer, for 12 months or more. So the intensity of pain didn't matter which type of driving that you did, but if you were a long haul driver, you were more likely to have been putting up with it for more than 12 months. Now, often when we think about treatment for pain, we often think first of medications or analgesic tablets. And when we looked at the data, where there are records of prescription medications paid for by workers' compensation, we found that drivers received more prescriptions for analgesic medications than other drivers, more than non-drivers in the transport sector, and indeed our comparison group of all other workers. Now, one of the strongest types of medications prescribed for painful conditions are a group of medications called opioids. They are usually very effective painkillers, but they can be addictive and cause complications and side effects if they're used long term. Now, in general, the evidence recommends that opioids should be used when needed and only for a short amount of time. One, to avoid the risk of addiction, but then also the long-term side effects that happen if you continue to use them. When we examined the workers' compensation data a little bit further, we fortunately found that that's how the majority of prescriptions for opioids for truck drivers was being used. So on this graph here, you can see the red line, the bottom line there, which shows filling a small number of prescriptions early on in a workers' compensation claim, and that pretty rapidly dropping down to 0, which is exactly how opioids are meant to be used. And that represents nearly 70% of the drivers who had opioids as part of their workers' compensation claim. However, there were 2 other patterns that showed long-term use. A quarter, or just over 25%, the blue line there, which actually shows almost like a consistent low-level filling of prescriptions for opioid medications. And then there was a further 5% that had a similar pattern, but at a much higher volume. And it's the long-term nature of these groups means that drivers may be at risk of the complications of ongoing opioid use. And we really see that it means a proportion of drivers perhaps are not receiving evidence-based care in relation to opioid medications. So not only are drivers dealing with severe and long-term pain, it can be hard to get evidence-based treatment when it comes to pain relief. Another aspect that came out of this component of the project was the relationship between mental health and opioid use. It turns out that if an injured driver had ever used a mental health service as part of their workers' compensation claim, the probability of having long-term opioid use increased by nearly 800%. And injured truck drivers who were prescribed opioid medications had significantly longer median durations of time loss than those who were not prescribed opioids. So the type of medications that drivers are being prescribed, it can have long-term consequences. Now, I actually showed this slide in last week's webinar. So if you've seen it before, it's because we think it's a good one. This describes the location of pain described by the 332 drivers who completed our telephone survey. If you counted up all the numbers on this bar here, there are over 1,300 pain locations described. So just taking a very basic average, that means that there are effectively 4 pain sites per driver completing the survey. So on average, you could have a sore back, a sore neck, a sore knee, and a sore wrist if you're working as a driver. What we can see from here too is that by far the most common condition that drivers described was back pain. But that was followed by shoulder pain, neck pain, and knee pain. So we're covering the trunk and we're covering the upper limb and the lower limb. So it doesn't necessarily matter where in the body, but it's actually a challenge for drivers to stay fit and healthy and pain-free. And to use a driver's own words again, so as far as the back goes, I know when I'm going to injure it, not purposely go out and do it because it bloody hurts, but it's just it's good at the moment, it's good at the moment, it's okay, then all of a sudden it's just gone and it's too late. We asked also in our telephone survey whether drivers actually took any medications to actually help them manage the pain. And 30% of drivers that completed those telephone interviews were actually taking some form of medication for pain. The majority of the medications described were variations of paracetamol, like the trusty Panadol, and then also the non-steroidal anti-inflammatory medication, ibuprofen. You might know it as Nurofen. Medications containing codeine, which is one of those weaker opioid medications, and other stronger opioids were really only mentioned by a very small number of drivers. But it's really important to consider that medications are just one method of addressing pain. And while there are many medications that can effectively manage pain and are safe for long-term use, there are many other avenues for addressing painful conditions. And here's a driver describing their experiences in this area. It's a long quote, but I think it's a really good one. And I am biased, I'm a physiotherapist. I said that in my last webinar as well. So that's why I thought I've got to exercise. So I got back into exercise, which I kind of like. I can tell you that exercise, you hear about the vitality of exercise and what it does. It absolutely does release some endorphins or something. I know because I've gone through fairly low levels of fitness before. I've got one of those indoor rowing machines, which are just a beast, but they get you very fit and very strong if you keep at it. So I can absolutely tell you and truck drivers that you get into an exercise regime, and it doesn't have to be to that level. It's just walking every day. It increases your serenity of mind, your well-being, your happiness. It absolutely does, from personal experience. And that's one of the things that I really love about being able to speak to the drivers in depth. They give us such great pictures of what these things mean for them. Now, again, I showed this slide in last week's webinar as well, and that's really because exercise is a really effective way to address pain associated with a range of conditions, but especially the musculoskeletal conditions that are really commonly described by drivers. Now, in our survey, the drivers averaged 223.7 minutes, or roughly 3.5 hours of moderate exercise per week. And when we say moderate exercise, we mean things that cause a moderate increase in your heart rate and breathing, but still allow you to hold a conversation. So some examples could be brisk walking or some gentle swimming. Social tennis or golf. I don't know, my heart rate goes through the roof when I play golf. It's because I'm really bad at it. But guidelines recommend 2.5 to 5 hours worth of moderate intensity exercise. Vigorous exercise, on the other hand, refers to activities that cause a large increase in your heart rate, or breathing so that you puff and pant. So that we're talking about jogging or cycling or competitive sports. And for vigorous exercise, our drivers average just under 1.5 hours per week. And guidelines recommend 1.25 to 2.5 hours per week. So overall, under half of our drivers did the recommended muscle strengthening or toning exercises at least twice per week. And just under half met the recommended amounts of exercise on a weekly basis. So there's potentially a wide range of, a lot of room for improvement in terms of exercise and how that might help drivers manage with their conditions. And of course, we'd expect a wide range of exercise habits amongst the drivers. So here are some quotes that describe some of the differences in fitness levels seen in that smaller group of 19 drivers that we interviewed in depth. So this from one driver: I try and walk 3 times a week. So that's probably about my level of fitness at the moment. I'll go and do 5 kilometres 3 times a week. So I'm mobile, but definitely not fit by any means. Compared to another who said, I went for a walk on Tuesday. I thought I'd be able to do it. I made it halfway and called for a taxi. My health is deteriorating that much that yes, I can still walk, but I can't do any more long distances. And here's one that's perhaps maybe somewhere in the middle of those two. I'm reasonably fit. I don't do much cardio work, but I do a bit of weightlifting, bodybuilding type work. Not too serious, but just enough to build some strength and keep my core healthy since I'm sitting in a truck all the time. So generally it's pretty good. I haven't got any underlying health issues that I know of, which is great. So we can see from drivers that there is quite a variation in terms of their health and fitness levels. For one driver we interviewed, exercise has become a real focus as part of a healthy lifestyle, but he actually had to make changes to his work to do it. And so he says, the thing is that I found is that you don't have the time. One of the reasons I've gravitated to local truck driving is because I want to keep fit. I want to keep healthy, and I'm relatively good. So I've got a home gym. I need to get a job that allows me to regularly exercise. You can't do that doing long distance truck driving. There is no opportunity to do that. So not all truck drivers can effectively change the nature of the work that they've got to do to achieve their exercise goals. But probably one of the most important thing a driver can do to help manage any musculoskeletal conditions or their general health or manage their pain is to see a trained health professional for help. For some, that's no issue, stated plainly by this driver. If I've got a problem, I just talk to my wife or go see the doctor. I've got no issue with that. That was the driver's quote, not me saying I've got no issue with that. But drivers also describe that the macho mentality of drivers in the industry in general. That means they're probably likely to put up with a great deal of discomfort and continue to push through the pain barrier. And often when they simply just don't need to. It's important to encourage drivers who are experiencing pain to get it checked out. We know chronic pain or pain that's been around for a long time is really difficult to effectively treat. So getting on top of a painful shoulder or getting advice on how to safely mobilise and strengthen when there is pain is a better long-term strategy than letting things build up. We know from our research that dealing with multiple health conditions impairs driving performance. So dealing with pain then and there should be a priority for drivers. In the long run, it'll mean more jobs done over time rather than just getting the current job done. But that requires action from more than just the driver. It also means other players in the system need to place a priority on driver health and wellbeing. And in many places, and in many ways, that's easier said than done. And really, that's what's led us to the next step in the driving health program. So like I said, it's not just up to the drivers. Some people think that it's just up to them to stay healthy and be healthy. But we know from our 2 years of research that the solutions are complex and they require a multi-pronged approach. It's not just about the driver, it's about the industry, regulations, and the way each company works with and supports the drivers as well. We've developed a free, short 20-minute online training program that's coming up in October for allocators, managers, or supervisors, whatever it's called, someone who works with drivers at your workplace, to identify what areas they have and can influence, what influence they have in relation to help drivers supporting their health. So we would love to offer you this free training, and with it comes a list of resources to help make your job easier in relation to how you could help support the driver to be healthy and stay healthy at work. So please click on the link and sign up now. I believe Elizabeth's probably putting it in the chat as we speak. If you sign up for that training program in October, we'll let you know when it's available, and we'd love you to complete it. That's it from me, Elizabeth.
Brilliant. Fantastic. Thank you so much. Okay, so we have a question. So make sure that this is time for questions now. So if you've got questions, put it in the Q&A or the chat box, and we're going to be working through the questions going forward from here. So remember to pop your questions in, and we've got a few minutes remaining for that. So we have the first one from Lisa. She said, for the severe levels of pain, was there any correlation to the age of the driver?
Now I'm trying to take my brain to the analysis. The analysis of that particular part is in report number 2, where we looked at. No, sorry, it's not report number 2. It's report number 4. This is the problem with having 8 reports. I know that age is certainly correlated with certain types of conditions that drivers had, for example, hearing loss. In terms of that pain intensity, I know it's in report. We looked at it in report number 2. It doesn't stick in my brain as actually being one of the strong predictors of pain intensity as an outcome. So it's not a great answer, but we could always get back to you on that. But it is in report number 4, which addresses it's report number 6 that addresses the online survey.
Online survey? Yeah, report number 6.
That's report 6, apologies. Report 6 is the online survey. That's the one where we actually captured all of that pain information that had on the slide with the graphs.
Yeah, absolutely. And just for me to add to that, while the questions are starting to come in, the interviews that I did with people in depth, they were talking about the longer they were on the road, so the longer the number of years they were in it, so therefore they're aging as well. But it's not a correlation specifically in the terms of data analysis. But what they were saying is the longer they're on the road, the more stiffer they got, the more pain they experienced. And so many of them were 20, 30 years in the field of working and as a truck driver, and so they were experiencing lots of niggles through to some sort of extreme levels of pain, which we would potentially call an injury. So again, that male macho, I'm okay, it's all right, we'll just get on with it, and that sort of little gradual increase over time that they may not notice, they're things that we need to think about as well. Cool. So we've got another question come through from Meryl. Has opioid addiction been identified as an issue for truck drivers in Australia?
In the driving health study, we weren't able to determine that. So I am unsure in terms of how to answer that. I'm sure there are other sources that have been able to find that out. Certainly in our telephone survey, there wasn't a huge amount of disclosure of taking opioid medications. I was looking at the data just recently. Those who describe there were strong opioids that came up, for example, OxyContin, but the reported frequency of taking that was basically once a month. And it sounds like the sort of thing that might be to deal with a flare-up. We would need to do further investigation to find that, but if there are people out there that have more information on that topic, we'd be happy to distribute that. What we saw in the data was, in terms of opioid use, was that there was a small proportion that had a large number of prescriptions filled under workers' compensation, and that's signed off by a doctor throughout the time. So, and that's all we can tell from the data. It's literally just a database. We don't have any of the reasons behind all that information.
Awesome. And we have another question from Kim. Did truck drivers show concerns with advising employers of pain for fear of loss of employment or work hours being reduced?
Yep. Yes, for you, Elizabeth. I can see you gesturing that way. Yep.
I was like, yes, definitely. Yes, many of them, the people that I interviewed in depth, were talking about fear of mentioning it to their allocators, line managers, supervisors, or any other person that they called boss, for fear of exactly that, losing their job, not being put on any shifts, being told that we don't have a role for you anymore, see you later. And so there was definitely some concerns by many of the people I interviewed around that. I think it was 2 had said they had experienced being dismissed after admitting that they had a health condition. And from memory, I think one of those was physical condition and one was a mental health condition. And so they had experienced being dismissed or experienced not being requested to come back again. And so, and that sort of impacted in a whole lot of other ways around mental health, providing for family, levels of stress, suspiciousness of managers and companies, and all that side of things. So these are some of the reasons why we're really wanting to look at how can we also support the line managers, the supervisors, the allocators, that level of middle managers in the industry. How can we support them and you, if you're on here, in different ways to help make your job easier, so that we can support drivers' health and well-being in many different ways, and not go, oh, hang on, you can't do that, so that's it, we're going to wipe everything off. So we need to look at this going forward as well.
It's one of the targets of that driving health allocator training program is really about just trying to increase that awareness, that so we can encourage people to drivers, if they're sore, that we can actually encourage them to actually take that next step, to get it investigated, get it under control, and so they'll actually be able to do the job, but do it comfortably. Yes,
brilliant. And we've got another question come through from Meryl. Did truck drivers demonstrate an understanding of their occupational health and safety rights in relation to pain caused by their work?
When it comes to occupational health and safety, we measured the levels of training that they'd received. And we actually found that having good occupational health and safety training was actually had a protective effect for both on mental health, but then also general health. That doesn't demonstrate an understanding. That just sort of said if they had it, that things were better for them. Perhaps there was something in the interviews, Elizabeth?
Some of them talked about the cab and the things that some of the companies put in place to help reduce the vibration and make it easier and smoother for them as well. They talked about some of the trainings that they got from it, but they didn't sort of go down that whole thing of this is my right, that side of things. A couple of them talked about bringing the union in in relation to helping to support them, because that was when the truck that required maintenance on their end wasn't receiving the maintenance that was required to make their ride smoother and to make their pain less. And so again, one person actually talked about the experience of repeatedly requesting some changes and then was told, see you later. However, others had really supportive, amazing bosses and managers that were able to go, yep, whatever you need, we'll do it, we'll sort it because we want to look after you. So there was a different stretch, definitely, that was experienced. Okay, so we have another question from Meryl. All good, Meryl. Awesome. Through all your research, have you interviewed people with called drivers, so English as a second language? And if so, did they disclose any issues that were different to the other drivers?
I'll leave you to speak to the interviews, Elizabeth, but I'm trying to stretch my brain to the report number 8, which was the telephone survey that asked about the types of abuse, if they've experienced bullying or harassment in the workplace. And I think it was around about somewhere between 10 and 15% said yes, that they'd been bullied and harassed in the workplace. I'm struggling to think of if there was a specific question about if it was racial abuse. I can't recall.
Yeah, I think there was around harassment and bullying, because I remember, yeah, so it will be in report 8
Yes.
that actual answer within there as well. And in relation to who we sought, I mean, part of the ethics approval for the study and part of the way that we could achieve what we needed to achieve within the time frame was that people needed to be able to either converse in person, online, on the telephone, converse in English and or understand and write in English for the online survey. So that would have negated some of the people who English, not just English as a first language, we had many different cultures involved, but that may have changed the responses that we got in relation to that. So we have another question from Vincent. Does the severity and duration and treatment for pain graphs just look at physical pain, or is it consistent with mental health, such as anxiety and depression as well?
I'm not sure if I'm answering your question here, Vincent, but we asked very specifically about pain during the online survey. It was very, very much about, tell us about the pain you experience now. And then in the telephone survey, it was similar, where we asked them about pain, not necessarily in connection with a particular condition or with in connection with other conditions that someone might have. We haven't yet drilled down into the data to see what the pain level is for someone with a condition of X and Y, to see if it's higher for those who said that they had a mental health condition, or if it's higher for those with back pain, for example. We haven't gone down to that level of detail because we're really at the stage of, wow, here is the health profile, and it's actually quite challenging for drivers. So I'm not sure if I'm answering your question or not, Vincent, but it was very much about people telling us about the pain they experienced, not necessarily whether it was connected to a specific condition.
Mm-hmm. And we have one last one that we'll take because of time. Ryan has made a statement that says it's very difficult to specify responsibility for workers' compensation for sore back for older drivers. We've found many drivers just go to a doctor and say they've got a bad back without a specific incidence. And is there any further information or research available to shorten the investigation procedure by any chance, or lessen how employees think it's a rite of passage to lodge compensation claims for older injuries?
Oh, that's a
big question.
Challenging question there. I think, and I'm also mindful of the time, how long we've got. I'm a physiotherapist by training, and one of the things that I often find frustrating with the workers' compensation system is that there is always that search for that diagnosis or what is the specific cause of the pain, which for a lot of conditions is fine, but for back pain, we just know it doesn't work. You could have people say, well, then you need to go and get a scan. Well, we know that if you put two scans next to each other, they can look exactly the same to the medically trained professionals. One will have crippling pain and one will be fine, and you wouldn't be able to tell based on the scan. And there is that issue of liability that goes with workers' compensation. Well, someone needs to be responsible for this. That comes down to then saying, well, did work cause this problem or not? And it actually can become really challenging. There's a lot of money on the line, if you like, from a workers' compensation claim in terms of the disability that it can cause and wage replacement, and then premiums for the employer. But then there's also a person on the line as well. And I'll always take the view of that the best possible thing we can do is actually support that person to actually keep them as healthy and functioning the best that they possibly can. Where it gets difficult is then when dollars get involved, is who's going to pay for that if it's a treatment or if it's I need time off work. It's a really difficult question, and it's rooted in a lot of areas in terms of public attitudes to workers' compensation, and almost that that my job has caused this aspect. So it's a very fence-sitting answer. It's a very tricky one, but I believe always the best possible approach is to support the employee to be as healthy as possible, and it's usually in the employer's best interest long-term to help support that worker, regardless of whether they have a workers' compensation claim or not. because actually resolving their pain, resolving the condition, means you actually have a driver who's happier and is actually able then to do the job.
Absolutely. Wonderful. So we've come to the end of the 5th webinar. We've got one more, which is on Thursday afternoon, and that is driving through fatigue. And so I'll be presenting that, and Ross will be emceeing that on Thursday. Thank you so much for your attendance. A little snapshot of a huge amount of information and data in the driving health reports. And you can find all of that information, and you can find the registration for the DHAT program, Driver Health Allocator Training Program, which is just a 20-minute short online program that we're launching in October. So you can sign up for there through drivinghealth.net as well, and you can find all the reports within there also. So thank you so much for being here today, and look forward to seeing you next time if you come on Thursday. All of the replays will be up in the website as well under news and resources. The first 3 are already up there. So thanks very much.
Thanks, everyone.